Hello everyone, I'm Candace Adorka, and in this Spark community story, we hear from emergency veterinarian Dana Varble. Dr. Varble says emergency veterinary medicine is unique because you tend to see the worst of the worst. You're seeing pets when everything goes wrong. But as low as the lows may be, the highs from dramatic recoveries can stay with you for a lifetime.
So this couple came in and they had two Maltese, little white dogs. And they had come home from being out and both the dogs were down, non-responsive, laying on the floor, couldn't wait, unconscious. And they bring them in and their heart rates were super low and they're barely breathing. And we're like, oh my God, what is going on? And I go in the room and I'm talking to the client and I'm like, going through the history and we're checking things like blood sugar and it's all coming back normal. And I'm like, all right, hold on. I'm just gonna go look at your dogs again. And they were stable, but they were in bad shape. And I'm like, I'm afraid we're gonna lose these two little dogs and I have no clue why their heart rates are so low and why they're non-responsive and why they're like limp rags. And I turned the one little white dog over and there was a chewed up fentanyl patch stuck to the dog. So both the little dogs had somehow gotten into a fentanyl patch that was thrown in the trash in the bathroom from I think the owner's elderly mother, and chewed up the fentanyl patch, and they were both basically dying of an opioid overdose. And there's no way the owners didn't know, and there's no way, but there was literally a fentanyl patch stuck to the side of the dog. And I was like, oh my God. It was great because I was like, these dogs have a fentanyl overdose. I'm like, we can reverse this, we can save them. So we went and got naloxone, which is the same drug that ambulance drivers carry. We gave both the dogs an injection of naloxone, and it was literally two little dogs that were and they both went and were wide awake. And I was like, yeah! And it was really good. So we kept them on fluids and monitored them overnight. But it was literally dogs that I was like, they're gonna die. And then I was like, oh wait, nope, they're fine. And everyone was like, it was really gratifying for the staff too, because they were like, we don't know what's going on, we don't know what's going on. And because there were white dogs and fentanyl patches are clear and it was stuck in their little fur, literally it was just kind of luck that we happened to be flipping the little dog over and feeling it, and there was a fentanyl patch. And it had little teeth marks in it. And so they did fine, they went home.
Dr. Varble followed the traditional veterinary medicine path and joined a small animal practice right out of school. But after 2 years, she realized the pace was a little bit slow and it didn't really mesh well with her personality. So once she tried emergency medicine and working with exotics, she was absolutely hooked. Of course, it had its challenges. For one thing, she says there was a culture of trial by fire. New emergency veterinarians would be put through the ringer to see if they could handle the long hours and the stress. But today, with all we now know about mental health problems in the veterinary community, Dr. Varble says she sees a change, and emergency veterinarians may well lead the charge towards better self-care.
I'm starting to sense a little bit more of a shift of okay, if you work the midnight to 8 a.m. shift or the 8 p.m. to 8 a.m. shift, maybe you're only doing 3-4 shifts a week and there's no on-call or you're doing other things. And I think that also there's a sense of when you're off, you're off. Especially with emergency medicine. I think that's going to be one of the first groups to really recognize that everybody needs their recovery time. Because when you're on, you do need to be able to handle 5 crashing patients at once and a blood transfusion in one room and all that. But to do that, you gotta be healthy and you have to be in a good place. So I'm starting to see that more in emergency medicine, and I think that's gonna be probably the first area of veterinary medicine that gets really good at that, because we have to be. We have to be able to keep going.
Thank you to Dr. Dana Varble for sharing her story. And we want to know what you think. Have you had similar experiences in veterinary medicine? Do you see strides towards improved work-life balance? Let us know on social media or reach out to tell your own Spark community story by emailing spark@nabc.com.